Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by Andy Flanagan. Thank you so much for joining me today.
Rosa, thank you for having me. Love your show.
Oh, well, thank you. I appreciate that. So, you and I haven't met in person quite yet,
Wow.
but you are in charge of Iris Telehealth, right?
That is correct. I've been
You are
CEO
the
for years now.
the CEO, and it is a telehealth company that specifically focuses around mental health, right?
Yes, we are a 100% virtual telepsychiatry company. We employ approximately 620 clinicians, psychiatrists, and therapists. And we work in 43 states with health systems, community mental health organizations like CMHCs, FQHCs.
That is so important. FQHCs are so amazingly important, and I think I heard that they're going through some funding issues right now, right?
Yeah, the One Big Beautiful Bill had a provision that made it very difficult around specifically the Medicaid population related to the ACA. There's a recent legislation for the rural health transformation that puts $50 billion back into what is largely the FQHCs, but we still have a lot of FQHCs in cities that
Mhm.
are really outside of that funding. So it's a critical primary care function
Yeah.
for Medicaid, Medicare populations. Right.
Yeah, definitely. The more I learn about them, the more thankful I am for them and want them to get all the support they can get
From
because it's
yes, they're amazing organizations. It's incredible.
yeah, especially even in cities like you said. I mean, underserved populations that are lower income and have less access really depend on those. So, So are you a psychiatrist? How did you get into this?
Oh, so our company was founded 13 years ago by a child psychiatrist, Dr. Tariq Shaheen, and
Not a psychiatrist who was a child, right? Just a psychiatrist for children.
I beg to differ, right? At any rate, no, it was a strong founding team, and 7 years into their journey, Tariq decided he wanted to have some other pursuits, and they brought me in as CEO.
Well,
So
sweet.
it's always been a strong company, always 100% virtual, always in the community. Since then, we've developed solutions for enterprise health systems. We're in emergency departments, medical surgical floors, and really our North Star is delivering high quality access to mental health care, and that includes prescribing. So we're a very high acuity medical group.
Yeah. And let's see, I've used telehealth for like counseling before. I think I've used BetterHelp before.
Sure. Great
So
company.
it would you say Iris Telehealth is more something that would be used like inpatient or in a doctor's office, or can people use it from home as well?
Well, so yes to all of those. If you think about BetterHelp, you can
Mhm,
go to their website and you can find an appointment and you can see somebody.
mhm.
We work underneath the FQHC, the health system. So if you went to Texas Health Resources and you said, I want to see a therapist, you would actually be an Iris therapist that you're seeing. You just don't know
Mm,
that.
mm.
So
So would it be through their, like, electronic, thing like MyChart?
that's exactly right. You go to their
Okay.
website, you'd self-schedule through
Mhm.
MyChart, and we would be on the other side of that. So we actually look just like our customers' clinicians. You would never know. You'll never see the Iris brand
So it's white labeled?
white label.
Okay,
We're an
nice.
in-sourced medical group. It's so hard to recruit and retain behavioral health clinicians. The burnout's high for all clinicians, but
Yeah,
especially behavioral health.
for sure.
And so, our medical group is a core function for us. Our NPS score is 91. We work very hard to meet our clinicians where they are, and we do many things relative to the kind of work we do to ensure we're optimizing the clinician experience as much as the patient experience. So that's our specialty. It's what we're really good at.
Yeah.
We're just laser focused on, we see all pediatrics, geriatrics, all diagnoses, low acuity, high acuity. So we're a very strong medical group, but it really is all about quality outcomes for us. And so that's where we spend our time.
And are all of the providers that you have actually like prescribers, or do you have plenty that are more like LCSWs, talk therapists who could do that cognitive behavioral therapy, but they don't write drug prescriptions?
So specifically, two-thirds of our 620 clinicians are prescribers, psychiatrists, MDDOs,
Mhm.
psychiatric mental health nurse practitioners. Coincidentally, one-third of our clinicians are actually LCSWs, as you exactly say. And so we do both, and that's very normal in the course of a journey that
Mhm.
bed management once a month, and I see my therapist, and then I go back and right,
Mhm.
and
It's
then
a
I
good balance. It's a good balance. I really like it that way because, then some people are distrustful of someone who has access to give you pills if they're like, "Well, maybe they're not making me talk as much as they should, and they're just giving me a pill," you know? And then, sometimes talk therapists can't get through to people because they need some medication in order to be able to talk things through. So, it's an important balance.
it is, and we chose our we call customers partners. Our strategy of working with health systems and community organizations specifically for continuity of care. So we are in the electronic health record system of our customers so that all of the data lives in one place, all of
Mm,
the outcome data. If the primary care clinician says, I want to break the glass and understand what happened with Andy, it's not an integration, it's not a request, it's in their native system. And so
good.
continuity of care has always been a challenge in healthcare, right? We all know
Um,
that where things start to break down. So we're
so, have you worked with in, like, the mental health kinda space on the business side, like, your whole career, or is this new for you, or
so I've been in
what's your
healthcare my whole career.
Yeah?
Actually, psychiatry is often part of neurosciences in a health system. And my last company I ran for 5 years was a neurosurgery company. And so in the CNS, central nervous system world,
Yeah.
I've been around behavioral health for probably the last 10 years or so. Prior to that, really primarily in software, electronic health record software with CMS,
Mhm.
ran SAP's healthcare business. And so I've always been in the enterprise healthcare business. This is the actual first time with a real, actual medical group in the middle of the company.
Oh, okay.
So it's been a great education.
Yeah. And then I'm sure there's a lot of overlap, though. I mean, there's so many parts of the business process that are similar, right?
Nothing happens if we don't get scheduled. Nothing happens if there isn't a claim, so you need a record.
Yeah.
Nothing happens if, right? So you need a referral. So yes, healthcare is healthcare. The reason I really came to Iris, number one, the culture of the company was stellar, as it is today. We
That's
fight
so
every
nice.
day to keep our mission in front of us. Running companies is hard, and in behavioral health where reimbursement is low, it's especially difficult. And so the mission orientation of the company allows us to lean into ourselves and acknowledge it's a hard business and reward ourselves and celebrate when we're successful. And I'm so proud of the medical group, but also 160 corporate employees who every day support the clinicians and our partners,
Mm,
very central to the patient journey. And so without the the management services organization that does all of the administration, none of us would ever be able to get to a clinician, right? Because that's not their job. So
so true.
it is a strong partnership.
So what is your mission that you stay
Our
central?
mission is to provide access to high quality behavioral health care. And that means that we serve communities that are underserved. We see patient journeys that are hard. We focus on serious mental illness and we focus on the community Medicaid, Medicare population from the very beginning. It's because they deserve to be served. And our partners, the FQHCs, and our partners, the CMHCs, um, they understand our commitment to our mission and their mission. We have a shared mission. We are a medical group. We are them. It really allows us to keep our true north without saying, well, this is what we say to a customer and this is what we say to ourselves. We
Mm.
are our customer. It's one voice. So there's only one Andy. It's the same Andy. I'm sitting here talking to you, whether I'm talking to Texas Health Resources or Border Region 4 in Texas, there's only one story. And
Well,
so
good. You don't wanna be talking out of both sides of your face. That can get confusing.
the formula for success.
No, not at all. So, what is your vision going forward in the next year or so?
I'm incredibly excited about how telehealth has become mainstream.
Yeah.
If you think about the name Iris Telehealth, our name will become obsolete.
Mhm.
And that's really our vision, is that it's just health. And so
Mhm.
uh, I see it happening. You see in health systems, they have chief operating officers of virtual care, dedicated buildings at Sanford just for virtual care. And that's exciting for all of us because we all live our lives. Often we put off care because it's hard, it's awkward, we don't have the time off, we don't have money for gas in the tank, whatever the reason is, right?
Mhm.
And we really should use this. It's safe, secure technology. So number one in that 18-month window is a full acknowledgement. We're seeing this a little bit in the legislation, but they're still playing around with, well, I don't know, should we really approve the telehealth thing again? You're like, really?
Are
Yeah.
you serious? What, are
The
we gonna go back to the Stone Ages? Come on.
second thing I'm excited about is there are two programs that the government is actually releasing. One is the Rural Health Transformation. And just like when we did the High Tech Act to fund electronic health record systems for healthcare, this is going to put critical dollars into the rural communities to for both infrastructure and access. And that's going to really alleviate probably the most underserved populations in our country. The
I hope so.
second thing is the CMMI RFA for access model, which is a next generation view for Medicaid patients around four key areas on a new digitally enabled care pathway that today traditionally would not be reimbursed by CMS in the current structure. So it's a new payment methodology, just like when ACO and Medicare Advantage came out, ACO Reach, same idea. And this is specifically aimed at musculoskeletal, kidney, cardiology, and behavioral health. And so there are
Hmm.
250 companies that have applied in one of those four categories to introduce for 38 million, in this case of behavioral health, there are 38 million lives in the Medicaid population that have some form of a behavioral health journey that needs
That's
access.
already known about.
They're known about, they're established. And so these dollars and these payment models will allow us all to lean into proven practices that can really bend the clinical outcome curve and help us all live better lives. So those are exciting. Those are real dollars. The first checks on the RHT went out last week.
Okay. Well, at
Hundreds of
least
dollars. It's amazing.
at least it's happening.
It's happening, Rosa. It's coming.
We will always want more, but at least it's happening, right? We'll
Let's
see.
start with some. That's right.
Well, that kind of brings us to my favorite question, the $1 billion question. So, Andy, you're an idea guy and you've seen a lot of different things, not just telehealth. You've seen devices and medical groups and all kinds of things. If you had a grant for $1 billion and you could use it to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Well, for me, it's an easy answer. I believe that our first responders, EMS, all of the police, fire department, our
Mhm.
first responders should have fully integrated access to all the medical records.
Yes. Yes.
Just tie them into the HIE. Just give it just like no muss, no fuss, special access, triple pinky swear. Here you go. So that when they're in front of me and they find out who I am on their tablet that everybody has, in one button, they could say, oh my goodness, Andy has epilepsy. Andy has, so they don't know, right? And they show up and I'm just sitting there. They don't know what I'm dealing
What
with.
if you're supposed to be wearing some armband that says you're high risk in some area and you're not wearing that armband?
I got an MRI that day. I took it off. What? You know what I mean? Like life happens. And so for me, I think $1 billion, number one, it's not enough money to solve a big problem. So you got to be really specific. Number two, we see all the things that go wrong due to people not understanding behavioral health issues. You can see my arm's broken, but you can't see if my mind's having a hard time, right?
Yeah.
I think that our first responders are doing work that we all cherish, you know, I mean, it's just amazing what they do, and they show up every day and put their lives in on the line, and they should have access to everything that we could possibly do. This one is very doable. So for $1 billion, I'm taking door number one, interoperability for our first responders.
I love that. Thank you so much for saying that. It is so important to include them as such a, like they're the first line of defense, but they're part of the healthcare team. But did you know emergency medical services are under the Department of Transportation, not even the Department of Health and Human Services?
Rosa, see, this is what I love. I love this exchange. I just learned something. I
Right?
didn't know that.
Well, how about we use that $1 billion to move that over here? How are they supposed to measure the quality of the healthcare being provided by our emergency first responders if they're more preoccupied with the quality of the roads? Like, yes, please take care of the roads, but also that's not your department. Can we please?
Yeah, that's like one black Sharpie pen away from just moving across, right?
I mean, I don't know the intricacies of it all, but I want to learn more.
Yeah,
So, and I really feel like that this could make a big difference. Like, especially like in the state of Kentucky,
yeah,
our emergency medical services, like the ambulances are county by county. It's not state
yeah.
funded. It's not streamlined and standardized. It's just all separately funded. And like fire departments are like a lot of volunteer based.
100%.
Yeah.
Yes, exactly right.
So they don't have a lot of the quality supports that we have working within a health system. So I think there's a lot of restructuring there that can make a big difference.
Mhm. I agree with that.
So, well, thank you so much for dream building with me there. And if
That's great. I enjoyed our time together as well, and it's very thoughtful questions, so thank you for that.
yeah, well, we're all working towards the better healthcare future together. So, well, if someone wants to reach out to you about Iris Telehealth, where can they find you?
So you can find me on X, iristelehealth.com, or come to our website. You see link right there. You can drop me a note. You can find me on LinkedIn.
That's right.
Yeah.
I will
Great.
put all that in the show notes here. And for those of you who are listening or watching on YouTube, if you've enjoyed this conversation, please like and subscribe or follow wherever you're at. And if you have thoughts or additional questions that you think didn't get asked, drop it in the comments. Like, be part of the conversation. If you know someone who has an answer to the $1 billion question and it needs to see the light of day so somebody can make it into reality, please reach out and contact me. I'm on all the social media platforms at Nurse Rosa Speaks, and you can find me on my website as well, nurserosaspeaks.com. So feel free to reach out, and I will see you all in the next episode.